I feel the procedure that I'm about to show you is the best surgical approach to most bunion deformities. This is a minimally invasive procedure that requires only 3 tiny poke hole incisions. This means no sutures are required and there's no permanent fixation. So there's no screws, pins, or hardware that's going to remain in your foot once the procedure is completed. You can walk right away in a shoe or a boot. Because the incision is so small and there's no hardware left in your foot, the complication rate with this procedure is so much lower than traditional open surgery. The first step in the procedure is to make a very small pinpoint, or what we call a poke hole incision, on the inside of the foot, just behind the bunion or the prominent bone that we call the first metatarsal head. Once the cut has been completed, a surgical burr that's only a few millimeters in diameter enters through the poke hole to make a precise cut in the malaligned bone. The front portion of the metatarsal or the metatarsal head is then slid laterally toward the foot's interior, shifting the end of the bone back into its corrected position. We now move up to the toe, where a second small poke hole incision is made. Next, the same small diameter burr is used to make another cut, now in the bone of the great toe. At this point, the great toe is shifted medially and the metatarsal head is shifted laterally into their corrected position. Both of these bones can be rotated if necessary at this point in the procedure. After this, a third and final small poke hole or small incision is made on the inside of the big toe toward the end. Next, a pin is placed into the toe along the side of the corrected bone, along the side of the first metatarsal, and into the first metatarsal shaft. This holds the bones in their corrected position while the bone begins to solidify and heal. At this point, any prominent bone on the inside of the foot can be removed as necessary. Once the bone is in a strong enough state, the pin is then removed and the bone continues to heal. This leaves the first metatarsal and the great toe, or what we call the first ray, in a newly healed and aligned position. Again, all with 3 very simple, small little incisions that make it much easier for patient's recovery and very minimal, if any, scarring long term.